Hello everyone, my name is Alison Woodall and I'm a relocation coach. That means I get to help you with the financial, logistical and emotional issues that make moving to a new state so stressful. And today I am talking to Burton Hayden and he is a life and health insurance broker. Burton, welcome.
Thank you very much. Appreciate you having me.
Well, I am looking forward to talking to you all about health insurance and life insurance and how you can help everybody in the group. But before we get started, I would love to know about some of the places that you've lived, because you've lived in a lot of places that I love. So to start off, you used to live in Wyoming. What do you love about Wyoming if someone's thinking about moving there?
Correct. So I lived in Wyoming pre-Yellowstone. So now everybody correlates Yellowstone to Wyoming, and it's not quite like that, but there are a lot of similarities. I did grow up on a cattle ranch similar to Yellowstone, but not to the extent. Some of the things I loved about Wyoming were being in a smaller area. We didn't really have to worry about anything. I lived in a very small town. We had one high school. I knew everybody. Everybody knew who everybody was, which could be a good or bad thing. I did have the opportunity to go back to Wyoming for about 10 years and raise my kids at younger ages, and I felt it was great for them also. So it was a great place to start being raised, but I quickly left there because I was 18 years old and wanted to get out of Wyoming as quickly as I could and kind of expand to see what else was out in the world. And so, like you mentioned, I lived a lot of places. I moved from Wyoming to where else? Las Vegas, Nevada, where I lived for about almost 6 or 7 years.
Wow. And then you said you went to Austin as well, because Austin is a place that many Californians want to move to. Did you enjoy your time there?
Correct. Yeah, we moved, my family, actually, my wife and my 2 children, we moved from Las Vegas, Nevada to Austin, Texas. And we absolutely loved Austin, Texas. I can say that's one of the few places that I had no pitfalls other than maybe traffic related pitfalls. The traffic is very extreme there, but the city itself, it's a small town feel in a big city. So you get all the benefits of being in a city, but you get more of a small town feel, especially when you start getting into some of the suburb areas like Round Rock and Georgetown, which is actually where we resided. And I actually worked in Austin, Texas. So there's a lot to do there for families. There's a lot to do there for adults if you're looking for activities as well. So it was a fantastic place to live.
Wonderful. And now you're in Dallas. And I was talking to a realtor last week about Dallas. And so if you want to learn the details about Dallas, you can check out my video with Josh Long. But are you loving Dallas?
Yes, we absolutely love Dallas. Now that we've been here, I don't think any of us, including my 2 kids, will leave. Definitely not leave Texas. Probably not leave the Dallas-Fort Worth area. There's just too many things, too many opportunities for all of us to do, whether it's college related and school related, or it's just activities to do for the family. It's a fantastic place to raise kids and to live.
Well, wonderful. Well, so you are a health and life insurance broker. So what kind of services do you offer for people who are leaving California?
Correct. So I think to start off with, kind of to elaborate on what exactly a health insurance broker is, as opposed to a health insurance agent. When you're looking for health insurance, most people, just don't want to shop for health insurance. It's not probably the most exciting thing to shop for. A lot of people don't truly understand exactly what they're getting in with their health insurance plan. And so when you're shopping and you reach out to get a quote from a carrier, you're going to get an agent on the phone. That agent exclusively works for that carrier. So their job is to sell you that insurance plan. Whether it is the best fit for you or not, that's what they're trying to promote, is that one plan. Versus a carrier like myself, I actually don't work for any carriers. I contract with numerous carriers. Currently, I have about 25 to 30 carriers that I can shop. So rather than working for that carrier, I essentially work for you, the client. You come to me, we discuss what your needs are based on pre-existing health conditions, what location you're living in, what your budget looks like. And I shop the entire market and bring back some options to you. And then we discuss those options. We have the ability to customize those a little bit more and a little bit more flexibility. And we try to find a better fitting plan for you. And then if that plan doesn't work, you come back to me and we find something better. Because when it comes to health insurance, there's not a one size fits all. I think everybody's starting to learn that, already knows that. There's lots of different options out there. It's just hard to sometimes navigate the different options that are available.
And I would agree. And when you're talking about shopping for health insurance, normally when you're moving, you've got a million other things to think about, and health insurance is vital, but you want someone to just be able to go and say, look, I found these 5 plans. This is, these are the 2 or 3 that I would suggest. And then you're just choosing between 2 really good plans that are really good fit for you. I know when we left California, the last thing I needed to do was find health insurance. We just needed like a stopgap insurance till my husband's insurance kicked in. And using a broker was just like the greatest gift, because it literally took me maybe 30 minutes on the phone, and he did everything else. So I think the service that you offer is just fabulous. So I would like to talk through a couple of different scenarios that people may encounter when they leave California. The first one is, the situation that I was in. We needed health insurance for 60 to 90 days until health insurance kicked in with my husband's job. What kind of plan would you suggest for someone? Would you suggest a short-term plan or a long-term plan? Are there pros and cons depending on the situation?
Yeah, so when you're relocating, there are numerous different situations. There's that situation where when you're relocating, you have a gap in either employment where you're going to be looking for a new job, or when you've got a start date of a new job and there's going to be a period with no coverage, or in some cases, some lawyers will actually put a waiting period on before your benefits will kick in. So rather than risking coverage and not having coverage, one of the things that I can offer is a short-term plan, and it can be anywhere from a plan that's a week in terms, or it can be a plan upwards to monthly, 6 months to a year, up to even sometimes 3 years. Those are all designed to be short-term plans and to help fill that gap in coverage. We again can come back and customize that plan to really fit your budget, or we can customize that plan to fit your needs and what you're looking for. So in that case, I would highly recommend using a short-term plan. And I have about 6 different carriers that all offer short-term plans. So we have a lot of options nationwide.
Okay, wonderful. And then if someone is moving and they're either self-employed or they have no idea whether they're, going to be able to get a job, or maybe they're retired as well. And so they, they don't have maybe they're too young for Medicare to kick in, or they would rather have their own private health insurance plan. Do you have longer term? Is there a difference between a short-term plan and a long-term plan in terms of prices, or is it just purely based on the benefits and all the different things that you want in your plan?
There's some very distinct differences when it comes to short-term plans and your more long-term plans. And a lot of those are just the internal coverage. Some of those short-term plans may have what we call a pre-existing health condition exclusion. So if you do have some health conditions that require frequent doctor visits, medications, that might not be the best fit for you. So, so then in those cases, we're going to look for a plan that is actually going to cover those specific needs. And I have the ability to layer plans on top of each other based on your budget, so that we can cover all extensive coverage that we need, whether it's for the pre-existing or for if you're just relatively healthy and you're just looking for coverage, whether it's catastrophic or for your day-to-day stuff. When it comes to self-employed folks, they probably have the most options. They just don't realize they have the options. They have the options where we can shop on the marketplace, which I am contracted with all the carriers on the marketplace, which is an important thing to have access to. Sometimes those wind up being the most affordable option because it is based on your gross household income. So in a lot of cases, you can qualify for a very substantial break in the coverage. And so they'll give you a subsidy. And sometimes you can qualify for as little as free insurance on a monthly basis. Or we can look at some of the private carriers that offer absolutely phenomenal coverage. And those plans can range from, again, a short-term coverage to a guaranteed renewable that you can keep until you're 65, and then you transition over to Medicare. And as you can see, I'm also licensed as a Medicare broker. And so I can help make that a nice, smooth transition as well.
Okay.
But one of the big niches is that retirement phase where you retire and you have that gap until 65. I help a lot of clients in that gap because COBRA is just very expensive. When you leave an employer and you get offered COBRA, what you don't realize is although they offer you the same plan, which can be a good benefit, you're losing that benefit of your employer contributing to your insurance. And so that price generally gets very, very high. And most people don't want to pay that or can't afford to pay that. So discussing that with me, we can generally almost always find options that are much more affordable.
Okay, I wanted to go back to something you said, shop the marketplace. What does that mean?
Yeah, so the marketplace is what we all know as the ACA. It used to be called Obamacare, and they've got away from that and just call it the marketplace or the exchange, which is a government insurance-based state to state where they have contracted with numerous commercial carriers to offer health insurance as a state-based health insurance. It does come with some limitations in certain states based on the network that you can shop or that you have access to. A lot of states, for instance, Texas, Tennessee, Florida, a lot of states where Californians are really starting to flock to don't offer any PPO networks. So you do have a little bit limited access to what providers you can use. So sometimes that's not the best option, but it can be the most affordable option in a lot of circumstances.
Well, perfect. And so I noticed that you had on your website critical illness insurance. Would that be if someone has a pre-existing illness, or is that if, like, my husband smokes? Should I get critical illness coverage for him? What is that exactly?
So when I'm customizing a health insurance plan, because that's really what I do when you come to me and you tell me you want health insurance and you get a quote, I customize and I put features into this plan to add the most protection. Because when we're buying health insurance, we're not really buying health insurance for the most day-to-day stuff. You can probably get away with getting to a doctor in urgent care and be okay. What you're really getting health insurance for is the same reason we have auto insurance. You're for that what if or that worst case scenario. And so when that worst case scenario hits, I want to make sure that you have the most amount of protection that is going to cover you for that scenario and minimize the out-of-pocket expenses that you could come across. So a critical illness benefit is essentially a rider that I put into health insurance plans to add another benefit. So if you are diagnosed with something very extreme, like a heart attack, cancer, strokes, maybe a major organ transplant, something that is going to keep you down and away from work for an extended period of time, that benefit is going to pay you back directly a lump sum number to help offset lost income, maybe out-of-pocket expenses for mortgages, car payments, groceries, anything that goes into your cost of living. It has really nothing to do with your health insurance or what would go towards the hospital. It's just an added benefit to help your day-to-day life so that you don't have an added stress at home.
Wow. Okay. Because being married to a smoker, it's always on my mind that at some point, we're very lucky. He's really healthy. I'm really healthy, but I want to have as much insurance and as much protection as possible. So that's good to know that there's something like that out there.
Absolutely.
The accident protection is that for people who have dangerous hobbies? You mentioned when we were chatting earlier, like bull riding.
Yeah, so the accident protector, it's kind of like, again, kind of designed to add an extra protection. One of the biggest places where we find people running into a major out-of-pocket expense is the emergency room, partially because hospitals are not really designed to make money in an emergency room. One of my backgrounds is an extensive, about 20 years in healthcare, and so I have a lot of history working with hospitals and on the EMS side. And so I understand how the billing side works. And I know when you go to a hospital and you go to an emergency room, they have one job and one job. Their job is to admit you into a hospital so that they can truly start making money from your stay in a hospital. When they can't do that, they discharge you, send you back to your primary care physician or a specialist for a follow-up, and then send you a very high bill. Insurance commercially primarily will try to protect themselves by giving you a high deductible, giving you a pretty substantial copay to offset that a little bit so that the client is really paying for most of that ER visit. An accident protector is really, again, designed for everybody because accidents happen. They really account for about 88% of emergency room claims. So that accident protector is designed to offset that cost. It's, again, a lump number that you would get as the client. So say we put it at $5,000, you would have extra $5,000 in accident protection. So if you did have an emergency room visit, whether you wrecked your motorcycle or you were hanging Christmas lights on the outside of your house and fell off your ladder, or you're riding that bull or that horse and got bucked off, whatever it was, you had to go to the emergency room and you had an out-of-pocket expense, you can use that accident protector to completely eliminate that out-of-pocket expense. And it's a very, very low costing extra amount of coverage that you can purchase or put into your health insurance plan.
Okay, that's good to know, because when we left Florida, and we drove all the way on a 6-week trip, all the way through Colorado and was it Utah? We did all kinds of crazy adventure stuff. And I was always thinking, if this UTV in the Moab desert flips over, that could be bad. So, it's always good just to have that extra level of protection, because you
Right.
never know what's going to happen.
And that's a good example, because with health insurance, a lot of times when you're leaving your home state, depending on your plan, you do start to get limited coverage when you start traveling cross country sometimes. And so if you had to go see a doctor, or that accident did happen, you went to a hospital, if you wind up at an out-of-network hospital, then in those cases, that accident protector would be a major benefit to have to help offset those costs, because you would probably get a balance bill and some out-of-pocket expenses from that.
Yeah, and talking about that, I know, because we were doing this 6-week road trip, and then when we came back from California to Georgia, we took a 3-week road trip. When I looked at health insurance policies, although we paid more for our health insurance because we had the kind of gap coverage, I needed to make sure, because we were going to be in so many different states, that I actually had a policy that would give me coverage in case we had a car wreck in Wyoming, or we had a UT flip over in Utah. And so I know there are policies out there that will cover you in multiple states. We were just looking more for catastrophic. We knew we weren't going to go to a regular doctor's visit. So can you also customize policies like that to cover different?
Yeah, absolutely. So outside of the marketplace, which again, I'm contracted with the marketplace, when I get into the private carriers, those are all going to be PPO plans, which are preferred providers, which are going to give you the most amount of access. And they're going to be able to cover you on those road trips across the country. You're going to have access to any doctor, anywhere, anytime. So a lot more flexibility in choosing your doctor, or to being able to travel.
Okay, wonderful. And then you also provide life insurance. So I know when you're moving to a new state and everything's in flux, you think, oh, well, it's the last thing that you're thinking about. But if you're moving to a new state, if you just bought a new home, if you've got so many expenses, that to me, life insurance is one of those things that you just absolutely have to have, even if it means you don't get your Starbucks, you don't go out for dinner. Life insurance is, it's just critical. Would you agree with that?
Yeah, and life insurance has actually changed dramatically over the last 20 years. When we talk about life insurance before, it was kind of just more or less a term plan. You get a lump sum when you hit 60 years old or 80 years old. Life insurance actually has turned into probably one of the safest and most substantial investments, because of the way and the different options they have in plans, to where you can actually get money back once you hit certain terms, which will help pay for a lot of expenses, whether it's long-term living, because that's one thing that health insurance doesn't do a good job of covering. If you get to that stage where you need home health care or long-term care, life insurance is where that's going to really cover that. And that's an expensive thing that you could likely have for the next 20 years of your life paying for. So absolutely, life insurance is an essential piece to be added on to protection. And you're not always necessarily protecting yourself, but you're really protecting your family members from those expenses.
Yeah, I would agree. All you have to see is, something catastrophic happening to a family who don't have life insurance, and it breaks your heart. But that's the reason I have life insurance, is for my kids and my husband. So, well, that's good to know. So your background is EMT and emergency medicine and all of those kind of things. For people who are watching this who are like, well, no, we'll be fine. We can just drive to our new state. We can figure it out. It's only 30 days till health insurance kicks in. What advice would you give for those kind of people?
Yes, speaking on the opposite side of being just a health insurance broker, my background was a flight paramedic. So for 20 years, I worked in a helicopter, life flighting patients from a hospital or from a scene to another hospital. And all of the patients that I worked with were probably thousands of flights that I did over the course of 20 years. I don't ever remember any of them telling me that they went into that day knowing that that was going to be the worst day of their life, that they were going to be in an accident where they wrecked their car, or like I mentioned, get bucked off a bull, wrecked their motorcycle, fell off the ladder, hanging Christmas lights, broke their ankle walking down the sidewalk, or maybe had that heart attack, the stroke. None of them said they knew that was going to happen that day. But all of them were going to get faced with some very extreme medical expenses, beginning with the life flight or the ambulance transport, then into the emergency room, and then possibly surgeries, hospital admissions, etc. So your health insurance, yes, it's going to cover doctor visits and it's going to cover your urgent care, but you're really getting health insurance for that what if, just like your auto insurance. Do you have hundreds of thousands of dollars potentially sitting aside just for medical expenses? I would say most people do not. And if you do have that money sitting aside, you probably don't want to spend it on a hospital bill. Let your health insurance protect you.
Yes, I totally agree. And because there's so many different stresses when you're moving, it's just when you know you're covered for health insurance and life insurance, it's one less thing to forget about. It's like a 30-minute or maybe an hour call to you, right, and it's all taken care of. And then you don't have to think about it. You don't have to think, absolutely, oh my goodness, what happens if, this happens? You can then focus on finding that perfect house, finding the moving company, getting packed up, getting excited about moving to a new state. Because when you've moved out often enough to know it changes your life. Moving is one of the most amazing things that you can do. And you want to eliminate as many stresses as possible and know that any, worst case scenario is taken care of. You're good. You got it.
Absolutely.
Well,
absolutely.
Anything that we haven't covered that you think people should know about?
No, again, when you're working with a broker, one of the added benefits that you get that you kind of overlook is just that one-on-one relationship with a personal broker. So again, I work for the client. So whether or not you decide to go and use me and get a health insurance plan, I'm always there as a resource. My cell phone is listed above. That's my direct line. So I have clients who call me or text me all the time. And what they think is maybe a silly question is never a silly question, because it may save them a lot of money based on helping them find providers, helping them find hospitals, just explaining something very specific with their health insurance. That is the added benefit you get from working with the brokers. They work for you. And so they are there as a resource, not just to sell you health insurance, but to help answer questions for you, to make it just an easy transition and to keep you safe financially and with your health.
Okay, well, wonderful. So obviously everybody can see, well, I don't know what to do. I'm looking, they can call or text you at that number. And you do have a website as well, if people are just looking for kind of a general overview. What's your website?
My website is www.herculeshealthsolutions.com. That's the name of my brokerage. You can see a little bit about my background. You can see all the different things that I offer and it can help you with. And again, if you have any questions, the easiest way to get hold of me is you can call me on my cell phone or text me on my cell phone, and I'd be happy to set up a time where we can discuss your current situation and see if we can help you out.
Wonderful. Well, thank you so much. You have shared so much great information, and I'm sure you've helped so many people.
Well, thank you. I appreciate the time.